You've hit week 28. Welcome to the third trimester. You made it. The baby is gaining weight rapidly, and you are probably feeling ready to be done. The glow has officially faded, and the waddle has arrived. If you drop your keys, you stare at them and decide they are gone forever. That is okay. Today, we are going to talk about the physical realities of the home stretch. We aren't just complaining. We're going to talk about why this is happening and how to survive it. Simply put, you are running out of room. It's a physics problem. The uterus is pushing way up into your diaphragm. Shortness of breath. You might feel winded just walking up a flight of stairs. This is normal. Your lung capacity hasn't changed, but the space to expand has. The fix. Sit up straight. Slouching makes it worse. And try propping yourself up with pillows when you sleep. Heartburn. That same pressure is pushing stomach acid up. The fix. The days of 3 big meals are over. Switch to grazing, eating 5 small snacks. And the golden rule, do not eat anything 2 hours before bed. If you lay down on a full stomach, gravity will work against you. Let's talk about sleep. They call it pregnancy insomnia, and it is cruel. The rotisserie chicken. You can't sleep on your stomach. Back sleeping makes you dizzy, so you are stuck on your side. But then your hip hurts, so you flip. Then the other hip hurts. The solution. You need a pillow fort. 1 pillow between your knees to align your hips, and 1 wedged under your belly for support. Vivid dreams. And when you do sleep, you might have crazy, vivid dreams. This is due to hormonal surges and waking up often during REM cycles. Don't overanalyze them. It's just your brain processing anxiety. As we get closer to week 35, the baby starts to drop. This is good for your lungs, but bad for your bladder. Frequent urination. You will pee. Then you will stand up, wash your hands, and feel like you need to pee again. The baby's head is using your bladder as a pillow. The sneeze pee. Also, sneezing, and pissing is a real risk. Wear a panty liner. It happens to the best of us. Lightning crotch. You might feel a sudden, sharp, electric zap deep in your pelvis. It sounds scary, but it's called lightning crotch. It's the baby hitting a nerve, or your cervix dilating slightly. It hurts for a second, then it's gone. You might be sitting on the couch and suddenly feel your belly get rock hard, tight like a basketball, for 30 seconds. These are Braxton Hicks. Think of them as a dress rehearsal. Labor versus practice. It is crucial to know the difference. Pain. Braxton Hicks are uncomfortable, but usually not painful. Real contractions hurt, like strong period cramps wrapping around to your back. Regularity. Braxton Hicks are random. Real labor falls into a pattern. The water test. If you feel cramping, drink a big glass of water and lie down. If they stop, it was just dehydration. If they keep coming no matter what, that might be the real deal. Swelling, skin, and the itch. Cankles are real. You might notice swelling in your feet and ankles, especially at the end of the day. Management. Elevate your feet above your heart. And, ironically, drink more water to flush the sodium. The warning sign. However, if you wake up and your face is puffy, or your rings won't fit, call your doctor. Sudden swelling with a headache is a sign of preeclampsia. Do not ignore this. The itch. Also, your belly skin is stretched to the max. Keep it moisturized. If the itching spreads to your hands and feet and becomes unbearable, tell your provider. It could be a liver issue called cholestasis. Finally, you might get an overwhelming urge to scrub the baseboards at 2 a.m. That is nesting. It is a primal instinct. Go ahead and organize, but please, don't move heavy furniture. Save your energy for labor. Be patient with yourself. You are growing a human and carrying a bowling ball around 24/7. It is okay to be tired. Rest when you can. In the next video, we are going to talk about safety. Specifically, the red flags you should never ignore in these final weeks. You are almost there, Mama.